Understanding lower back anatomy and treatment options for chronic low back pain. You are not alone if you suffer from low back discomfort. Low back pain affects the majority of people at some point in their lives. The soreness usually subsides within a few days to weeks. It can, however, linger for 3 months or more. Chronic low back pain is the term used to describe these long bouts. Low back pain is commonly treated using the following methods. Exercises, relaxation techniques, and pharmaceuticals are some of the options. Let us have a look at the structure of your lower back to see how these therapies perform. There are 24 vertebrae in the spinal column. The lumbar area is a common site for back issues and pain. The spinal canal is formed by an aperture in each vertebra that protects the spinal nerves. The vertebrae above and below are connected by facet joints and intervertebral discs. Groups of ligaments and muscles hold these tissues together. We can move because of the muscles connected to the spinal column. They also support the spine, which bears the weight of the body. If any of these muscles are tight, weak, or unbalanced, it might lead to injury. Other structures may be subjected to excessive wear and tear as a result of the pressure. Disc herniation, for example, is a common condition in the lower back. In this case, pressure on an intervertebral disc's nucleus pulposus has caused it to rupture. Low back pain is caused by the discs protruding backwards and pressing against the spinal nerves. For some patients, severe discomfort can also be felt in surrounding places where the spinal neurons from. On the affected side, the lower back, as well as the leg and foot, stretch. Exercise can help to relax muscles and relieve strain in the lower back. It is crucial to talk to your doctor about which exercises are appropriate for your condition. Consider the McKenzie method, which is a popular low back pain workout program. Lying in a prone position relieves pressure on the disc in patients with posterior disc herniation. Performing extension motions if your pain condition allows it can stretch and release stiff muscles gradually. With time, your lower spine gets more arched, pulling the disc center forward, putting your body in the right position and decreasing nerve irritation. As a result, the pain in your lower back and legs will be reduced. Exercising has many benefits than just relieving pressure on your lower back tissues. You may develop your abdominal muscles by incorporating back workout into your everyday regimen. Core muscles are the muscles in the abdomen, back, and sides of the body. As a result, you will be able to avoid low back pain in the future. For certain patients, relaxation therapies such as meditation in a relaxed stance can help with back discomfort, as well as cognitive behavioral therapy. This is due to the fact that our brain not only senses but also controls pain signals. Pain impulses climb from the lower back when back structures are injured. The sensory cortex, a part of the brain that senses pain, is reached via the spinal cord. This is not, however, a direct route. At least 2 connections must be taken. These relay stations, which include the spinal cord and the thalamus, are where the information is relayed. That the brain has the ability to control pain signals. Let us look at the first relay station in more detail. The dorsal horn of the lumbar spinal cord houses this structure. In this area, pain signals are sent from a sensory neuron in the lower back to the brain. In the spinal cord, there is a relay neuron. Pain signals are then transmitted to the brain. A special type of neuron that relays messages from the brain can lessen the pain impulse. As a result, the brain receives fewer pain signals, and we experience less pain. These brain impulses, on the other hand, can boost pain signals if you are agitated. As a result, research revealed that people suffering from depression or anxiety suffer from increased pain. Patients with a positive attitude and who are actively involved in their treatment experience reduced discomfort. You may also be advised to take pain-relieving drugs prescribed by your doctor. Comply with your current medication regimen. Depending on the type of drug provided, the side effects can be rather different. Some drugs aid in muscular relaxation. Some diminish pain signals by acting on neurons in relay stations. It is critical to listen to your doctor's advice and take his or her guidance seriously. Exercise, develop relaxation techniques, and possibly take drugs are all recommended. The advantages may not be immediately apparent, they take time and your active engagement. Taking an active and informed part in your own health is a great way to start. You will be able to better manage your pain and live a healthier life as a result.